Are GLP-1 medications like Zepbound or Wegovy a short-term tool or a lifelong commitment? In this video, I'm going to break down how long people usually need to be on a GLP-1 medication for weight loss, what happens when you stop taking the medicine, and how to know if a maintenance dose is right for you. Hi, I'm Dr. Bazgha Khalid. I'm a board certified internal medicine and obesity medicine doctor, and I prescribe GLP-1 medications in my weight management practice every day. And today I'm answering one of the most common questions that I get asked from my patients. How long do I need to be on these medications? Let's dive in. So let's start with the basics. What are GLP-1 medications? GLP-1 medications, commonly known by their brand names like Ozempic, Wegovy, Mounjaro, and Zepbound, mimic natural gut hormone that slows digestion, reduces hunger, and improves insulin response. And the result is lower appetite, lower blood sugar, and steady weight loss. So, how long does it take to reach goal weight? STEP trials for semaglutide and SURMOUNT trials for tirzepatide show that most people lose the majority of weight in the first 6 to 12 months. Weight loss may continue for up to 72 weeks, which is 1.5 years before stabilizing. As an example, in SURMOUNT 1 trial, people on tirzepatide lost 20% of body weight by week 72. So, are these medications forever? GLP-1 medications are similar to treatments for diabetes or blood pressure. They help control a chronic health condition. Obesity is a chronic relapsing disease, and when the treatment stops, the weight often comes back. Clinical studies like STEP 4 trials show that after stopping semaglutide, study participants regained two-thirds of the lost weight within 1 year. Now, this is a significant weight regain. What is a maintenance dose or maintenance plan? Once you reach your goal weight or a plateau, your doctor may either keep you on the same dose if you're tolerating it well, or lower the dose if side effects are bothersome. Sometimes consider stopping if lifestyle changes are very strong. The maintenance dose is the lowest effective dose that helps you keep weight off. Does everyone need long-term treatment? The answer is not always. If excess weight is mild, some may transition off the medication. However, if obesity is severe or linked with chronic health problems like diabetes, sleep apnea, fatty liver, then long-term therapy is often the best. Think of it like blood pressure medications. Most stay on blood pressure medications for life. Some may be able to taper off with healthy and consistent lifestyle changes. So, what happens if you stop GLP-1 medication? Appetite usually returns quickly. Food noise mostly comes back. Weight regain is very common. For example, in STEP 1 trial extension, most patients regain two-thirds of their lost weight within a year of stopping semaglutide. So, what are the do's and don'ts on GLP-1 medications? Do's are work closely with your doctor before deciding to change dose or stop. Use lifestyle tools like protein, fiber, exercise, sleep while on these medications. Plan for maintenance. Don't just stop suddenly. Don'ts are don't stop cold turkey without a plan. Don't expect lifestyle changes alone to always maintain large amount of weight loss if obesity was severe. Don't compare your timeline with others. Everybody's weight loss journey is unique. GLP-1 medications quiet food noise and reduce appetite. That gives people the breathing room to finally notice how much, how often, and what kinds of food they are eating. Many of my patients find that they naturally start eating slower, choosing smaller portions, prioritizing protein, and cutting back on ultra processed foods, not because they're forcing it, but because the medication helps them feel satisfied sooner. In a way, these medications act like training wheels for nutrition, giving people time and space to build healthier habits without constant hunger sabotaging their diet. So let's see these medications as training wheels for nutrition. They quiet food noise and make it easier to eat smaller portions, more protein, and less junk. The real goal is to practice those habits now while you are on a GLP-1 medication. So even when you come off the medication down the road, the discipline sticks. GLP-1 medications aren't a quick fix, they are a tool. For some, that means short term use. For most, it means long term or maintenance therapy, just like how we manage other chronic health conditions like diabetes, high blood pressure. The key is working with your doctor, setting realistic expectations, and using these medications alongside healthy lifestyle changes to create lasting results. If this video was helpful, then like, share with a loved one or a friend on weight loss journey, and subscribe for more evidence-based content. Stay happy, healthy, and well. Bye for now.